if there are people joining from near you, and would love to hear what you're looking forward to doing this spring now that it's so nice out. Yes. And we are located in Washington, D.C., so Institute staff and Niki with the U.S. Chamber Foundation. So I would say for us, I mean, I think just being out by the tidal basin, even though cherry blossoms are over, that's something that is always fun to see. Yes, love it. More DC, thank you, our people from Atlanta. Excellent. Looking forward to spring festivals. I know we're getting ready for summer, but I'm not there yet. I need a little more springtime. I need that perfect medium of before it gets too hot. If you're used to the DC weather or anywhere else that's hot and humid, summers are hard. So I will take the spring as long as I can. Let's prolong it. Farmers markets, yes, that's what I'm talking about. I love it. South Carolina, looking forward to the lake. Yes. Cedar Rapids, visiting cabin on the lake, a lot of lake. It's all about the water. To Boston this weekend to see a show. Very nice. Excellent. Well, I love to see it. Keep it coming in the chat. We are going to go ahead and get started. Oh, this is with grandchildren. I love it. And welcome to today's webinar. We'll be focusing on workforce development. We have two speakers today, so Niki DaSilva and Marianne Sheahan. And as a reminder, Institute is a CAE and a CCE approved provider. So that does mean that this Institute webinar qualifies for 1 hour of CAE credit and 1 point of CCE credit. If you are present on today's webinar, you are eligible and you can request a webinar certificate by emailing us. And a recording of today's webinar, as well as the presentation materials, will be available after the webinar. So watch for those. And as we are going, as questions arise, feel free to drop those in the chat and we'll answer those throughout. And then there will be more comprehensive time for Q&A at the end. So just to go ahead and introduce our speakers today. So Niki DaSilva serves as Senior Director of Programs and Policy at the U.S. Chamber of Commerce Foundation. Her primary objective is to support the Chamber Foundation's Talent Pipeline Management, or TPM, initiative. And for the past 2 years, she's led the digital transformation of the TPM Academy to an online, on-demand learning platform, running TPM CoLab. So you may be familiar with that. She also serves as a faculty member for both TPM Academy and for Institute with us. And Marianne Sheahan serves as the Chief Talent Officer for the Vermont Business Roundtable and the Vermont Talent Pipeline, which is an initiative of the VBR Foundation. She is widely recognized as a Vermont workforce leader, specializing in talent pipeline management, TPM, an employer-centered, demand-driven approach designed to address industry skill gaps. And under her leadership, the Vermont Talent Pipeline has partnered with over 185 employers across healthcare, manufacturing, and construction to develop direct recruitment and advancement pipelines, including on-ramps and high-demand career paths. Very excited to hear from both of these ladies today. And with that said, Niki and Marianne, I will turn the time over to you.
Great, thank you so much. Thanks everyone for being here today and for allowing us to join you. How many of you are familiar with talent pipeline management? Can raise your hand or pop it in the chat. Okay, I see 1, 2, 3, 6. Okay, so there's a handful of you. Double hands up in the chat, I like it, who are familiar with TPM. So I will go ahead and just kind of briefly give an overview for those of you that are not familiar with it. Awesome, we have somebody who's in the TPM Academy right now. Welcome. So just very basically, talent pipeline management is this idea of how we can utilize traditional supply chain management principles that maybe many of you are familiar with when you think about from a business operations standpoint, right? And apply that to talent. It's really the one place, if we think about how we run our businesses or how our partners run their businesses, that we don't take a more strategic approach where we're getting information from our end customer and their needs to help inform how we're building said product or service. And not to say that people or learners are widgets, right? We're not, we're individuals. But there's something to be said that when we have an understanding of what the end customer's needs are, and in this case, the employer being the end customer, what are their most critical jobs? What are the skills and competencies that people need to be successful in those roles? and providing that information back in a common language to get education and training providers, to learners themselves, that the types of experiences that they can have and the trainings that might be available are going to be more aligned to ensuring that they have a good line of sight to a good job and the skills to be prepared for those roles. So that's really what TPM is all about. It's how do we help empower employers and those who work directly with employers, so chambers of commerce, industry associations, and others, better understand how to develop that common language and really build a supply chain of talent. So how did we come up with this idea? I definitely didn't, but we have some really smart people who work at the Chamber Foundation and across the U.S. within our chamber network. And so Jason Tishko and one of our partners from George Washington University developed a white paper around this theory in 2014. And over the last 10 to 11 years, it's grown quite a bit. We've launched a TPM Academy, which is the training forum for learning the framework. And a couple of you mentioned that you are taking the course right now. And we've iterated on it, right? So all of the people who graduate from the TPM Academy are now what we call TPM practitioners. And so Mary Ann is one of those kind of star TPM practitioners, fellows. She's also a faculty member for us teaching in the academy. But as you all are implementing this in the communities, we are building new resources and specialty areas of how it can be applied. So I'll talk a little bit about some of those. Just some quick stats on how TPM has grown since 2014. We've had over 44 cohorts. We've had people from more than 46 states, 4 countries. We're close to about 1,400 practitioners. So if you think about in 2019, when I started with the foundation, we had, I believe, 119 people who had gone through the TPM Academy training, and now we're over 1,400 people. So it's really grown significantly in the past 5 to 6 years. And that means thousands of employers have also been engaged in this process. So a little bit about what makes TPM different. I'd be curious, since we have some people on the call that are familiar with TPM, are there any things you can call out in the chat about maybe what makes TPM different from other kind of workforce development strategies that you've engaged with before? You can just pop it in the chat. Employer engagement. Thanks, Marianne. Yes, it is definitely built on being employer-led, not necessarily employer alone, but really focus on how are you keeping employers engaged and sustained engagement over time. Yes, it really uses employers as a subject matter experts to drive workforce solutions, and that in part is by the use of employer data, right? And so you're getting information directly from your employer partners on what their needs are. And that information is what's kind of driving the decision-making process as you're going through the steps of the TPM framework. So it's data-driven, employer-led, focused on return on investment, and not just return on investment for the employer partners, but for all partners within that talent supply chain. Any other thoughts? You can pop them in the chat as we go along. So what are some of the outcomes that our partners see? And Marianne's going to talk a bit about what they've seen in Vermont. But typically it's lower onboarding costs, an increase in retention, increase in career advancement and diversity of the workforce, really reducing barriers to both entry, retention and advancement, and then really thinking about that system alignment and resource alignment within the greater ecosystem. And I apologize if you can hear the trash is being picked up at my house right now. So as I mentioned, there are several resources that have been built based on the TPM Academy framework. We have resources or compendiums in how to build high quality CTE programs, thinking about opportunity populations and reducing barriers to career pathways. We have resources around job quality, public policy applications, and of course, the one we're going to talk about today is apprenticeship. So what is work-based learning? When we think about work-based learning and we use our kind of TPM value stream map, it's really this opportunity about breaking down the different components of how people learn about work and then how they learn at and through work. And so we've broken down some examples of what that can look like. So career awareness might be industry or career profiles. Some states have what they call a career navigator or career explorer. That might happen in middle school or in high school. Career days where people can get exposure to those different job opportunities. Maybe it's a marketing component where you're building a day in the life of videos. Thinking about how career counselors are embedded into both when we're thinking about youth employment or apprenticeship, so into the schools, or if we're working with adult populations, what are those opportunities for them to also get career counseling? Maybe that's through a local workforce agency or through a nonprofit organization, and just basic introductory employer presentations. You could build on that career exploration with maybe on-site company tours, subject matter expert Q&As, career fairs, informational interviews, or job shadowing. And then we start to think about what does this look like as far as the opportunity to learn at and through work. And so this could be internships, might be pre-apprenticeship or mentorship opportunities. It could be industry-sponsored projects or entrepreneurial challenges. And we actually have a program at the foundation called EPIC, Employer Provided Innovation Challenges, that focuses on some of those types of work-based learning opportunities. But then you can move into some more advanced versions of that, which include apprenticeship, both registered and non-registered. And you'll get to hear 2 examples of that from Mary Ann, as well as clinical experiences or other on-the-job training components. And we know that in many communities right now, apprenticeship is one of the hot ticket items that employers are looking at as far as how to really build up their workforce, particularly in areas where we know that upskilling is going to be one of the most important pieces of that, and that maybe college isn't the direct path for everyone to a high quality job. So when we think about how TPM can help with that, it's really around that idea of sustaining employer engagement and engaging the employers upfront in the development of that apprenticeship program, as well as ensuring that there are standards for the reporting, the accountability, and a consistent cadence with the employers, so that you're able to really align it to that return on investment and that there's shared value for all. So this is just a basic overview of what it looks like to develop apprenticeship program. And I showed this to you because I want to give you an example of what it looks like when you really have employers engaged in the development of these apprenticeship programs from the beginning, and what this can mean as far as the leadership role that a chamber or an industry association might be able to take with supporting a group of employers and looking at this as apprenticeship as a solution. So this was the current state of an apprenticeship program in Michigan at the top. And once they were able to really get a clearer line of sight of what the skills and competencies were that were needed by the employers in that particular group for that industry, they were able to, as you can see on the bottom, reduce the actual amount of time and cost for the on-the-job training to happen, and to be able to specify the specific skills, really drill down into them that people would get as part of the initial components to their kind of pre-apprenticeship training. So it really streamlined the entire process, made sure that they had the exact set of experiences that they need to be successful, and reduce the amount of time overall for the learner. So it means they're getting connected to meaningful work and kind of advancing in that sooner, and the cost to the employer partners who might be the sponsor for that apprenticeship program. Okay, Any questions on anything I tackled so far? Otherwise, I'm going to turn it over to Marianne.
Okay, well, I'll give it a go. Hi, everyone. Marianne Sheahan. I work for the Vermont Business Roundtable in Vermont. In case you don't know where that is, it's way up near on the Canadian border. It's a very small state. And if you look at the population, it's among the smallest. We have 650,000 people in our state. So it makes it, I'm going to say we make the top and the bottom of every list. It makes it easy for us to actually work together as industry collaboratives. But I'm here to share with you a couple of apprenticeships that we've started in the state. So I want to start by just saying that we've been doing this work since 2017. And, I think, when you came today, you were probably wondering what's the combination of talent pipeline and apprenticeship? Why do we have those things mixed together here in our presentation today? One of the reasons is because of collective impact. So apprenticeships have been going on for a very long time, and employers have been, developing apprenticeships. A lot of times what they've done in the past is they've set it up for their own organization. Talent pipeline management uses an employer collaborative. You can see the blue circle in the center of this diagram. We've organized a group of employers who have shared hiring needs. What that does is it shares risk and reward for everybody who's involved in it. So employers don't have to go it alone. Ideally, what they're doing is, they're going through the talent pipeline management steps. The first one is really to organize as a group and decide they want to work together. The second one is to project what their critical jobs are. So once they pick out an occupation that they can all agree upon, that makes it a lot easier to focus on an apprenticeship. So they communicate the requirements of that occupation to the education providers. And then we look at the education providers in strategy 4. You can see these are numbered around. We look at the education providers and say who's actually able to deliver this content, and if not, who would be willing to modify their curriculum to help meet the needs of this employer group. And that's how we start building the talent pipeline. Apprenticeships really come in at strategy 5, that building of the talent pipeline. And then we're constantly in a continuous improvement model. But when people ask, when we work together with a group of employers and we start something like this, we just describe talent pipeline management as a set of strategies and tools that we can use together to fill the skills gap by aligning training. So the most important things about it really are that we have genuine, authentic employer commitment and demand. So I'm going to start with one of the apprenticeships that we've talked about in the past, which is the Vermont Construction Collaborative. And this is so exciting to me because we started in 2017, and right now we are in a major turning point where we're scaling this work across our state. So we started with 12 commercial general contractors, and in 2023, we actually asked if associates and builders and contractors would take this project on because we've asked them to sponsor the apprenticeship. So next slide, please. We started with what are the most critical jobs in construction, and critical can mean two different things. It can mean we need a whole bunch of those people. If you look at the column labeled carpenter, you can see that was our highest demand role. And then it could also mean we can't get any of this work done unless we have that role. It's that important to us. So our top 2 were site superintendent and carpenter. We are able to get some pretty good data from these folks. We help them with their forecast, but we ask them how many of these jobs are new, meaning there's growth in the industry, and how many of these jobs are replacement, which could be because of retirements, attrition, or even promotions and transfers. So next slide. So this is our talent pipeline for construction. Now I'm showing you this. It says 2024 at the top. The labor market information that we pull from the Bureau of Labor Statistics gives us salary information, but this creates the narrative that we're trying to develop for jobs. So we start with information that says if you're a laborer or a carpenter's helper, you're generally making between $19 and $22 an hour. But if you go through this apprenticeship, it will take you, some period of time, but you can see the average rate of pay for a carpenter is about $28 an hour. So we have this marked out in a pathway because these are the critical jobs that have been identified by the employers. And you can see that they're how they relate to each other. Some of them require formal education at the college level. Other jobs in the field can be developed using competency-based learning and experiences. So there's our dog. Hold on just. All right, so you can see that the ones that are in green on the top and even like that in between color green, none of those are actually a requirement that you have college degree. The ones on the bottom, the project engineer and potentially the project manager are college experiences. And so there are lots of different ways that you can move around, and there's a really good career pathway, whether or not you are using higher education as your pathway or career competency-based learning. So next slide. You saw this before. This is an oversimplification of what Niki described. When you're building the talent pipeline, what are we focusing on in our collaborative? We're talking about career preparation, pre-employment training, onboarding, and full productivity. So, the most important thing that employers need to understand is in selecting an apprentice, apprentices are your employees. You're not hiring an apprentice and then or hiring an apprentice who you don't know. Usually you've hired them to do some role while they're training and to become a carpenter. Next slide. So this is, when I'm trying to describe this to a group of employees, or employers, I always say apprentices are your employees. It's the most important thing that you need to know. They can work in entry-level roles and they're going to be upskilled on the job. There's two components. One is work-based learning, where you're doing on-the-job training, and the other is related course instruction, where there's some kind of a course content that's being delivered. The most successful apprentices are the ones that you already know and that have a desire to advance their skills. Okay, so that's fine. Go for it. That's just a description of what apprentices are. I'm just going to share, this is the history of the Construction Collaborative. We started in 2017. We used talent pipeline management to forecast job needs, to identify what the competencies and credentials were for those jobs, and then to analyze where people are getting their training from. By 2018, we had standardized a curriculum that all of the employers were willing to recognize with a guaranteed interview and a wage above standard if they ended up hiring the folks for it. We certified all the instructors who were teaching in the technical centers and in the other nonprofit training providers. As I said, we provided those incentives. We measured, what the numbers of people were who were going through, and that's where we started to design this apprenticeship. So fast forward to 2022, we started the apprenticeship. We got a sponsor, Associates and Builders and Contractors, to oversee it. We launched it. The first group had 12 apprentices go through. The second group, they changed significantly. They decided they were going to do, instead of a half a day a week of training, they decided they were going to do a full day every Friday for 9 months. And so the second group had 20 people go through. And here we are in 2025. The most exciting part is where we're scaling these apprenticeships. Next slide. You can skip this one. I already kind of described this as we were going. Okay, so on this slide, the most important thing I want you to see is that in 2024, we got $1 million gift from an employer. And ABC set up a nonprofit and a board of directors to oversee this training center. It's called the Vermont Construction Academy. It opens officially on Monday next week. We're expecting about 80 apprentices to go through in the next 9 months. We had all these employers donate their time and materials to outfit this 10,000 square foot facility for the training academy. And each apprentice will cost about $2,500 per training event. So we put that out there because you can see from cohort 1 to 2 to 2024, the cost was very little, but it's increased over time as the value to the employer has increased. So at first, we're sort of demonstrating that it has value. Then we're demonstrating more value. And then, so in 2025, just saying, they've hired the certified faculty members and looking forward to attending on Monday with the governor. So that's been pretty exciting. Next slide. Now we're going to transition a little bit to the Vermont Healthcare Collaborative. I'd like to just stop for a second and say that registered apprenticeship through construction had a lot of formal partners developing it so that we could make it successful. This healthcare collaborative is one that we've started sort of from scratch. So we don't actually have it registered yet, but we have it developed so that it can be a registered apprenticeship. So I'll describe where we're at. We started in 2018. We have about 84 employers who are part of it. We have 17 local hospitals. We have a number of home health agencies around the state, community health, primary care offices, and residential care facilities who are part of the collaborative. Next slide. We've developed a nursing apprenticeship program. When we brought it to our employers and said, what is your most critical job? Across the entire nursing career pathway, we talked about the demand for nurses. And I don't think that Vermont is that different than other states. I think that nursing is pretty important everywhere you could go. But this is John. Love John. He is an apprentice. His daughter made that sign for him on the first day of school. This is pretty standard for who an apprentice is. A lot of the folks who are going through these programs are doing it as a second career, potentially job changers, or never had the opportunity to go to higher education. And nursing actually is higher education. This apprenticeship is paid for by his employer. So this is what our, oh, sorry, go back one. Oh, maybe this, yep, that's it. This is what our nursing career pathway looks like. So if you're looking at the pipeline, we're focused on filling jobs that are the most critical to the employer. In some of the bigger hospitals, they're saying that we want everyone to be a licensed nurse assistant in order to go into the registered nurse licensure program. Other hospitals that are really small are saying you can do anything in our hospital. It doesn't even have to be a clinical role like the ones listed here. It could be you work in food service, or you work in environmental services or facilities. So anybody who qualifies, basically, who's interested, can go into a pool for selection. So they typically will interview people. They'll get a letter of support from their supervisor that says that they have good work attendance and a good record, and they'll train people to go to through the registered nursing program. You can see I have on the far right in the green, I've circled the clinical nurse educator. If you look at the salary for the clinical nurse educator, this is what's causing our bottleneck. We don't have enough educators to teach people because educators have to have a master's or a doctorate and they're paid less than a registered nurse. So, I also like to point out that registered nurse, you can have either an associate or a bachelor's degree to get your licensure. So the fastest way to become a registered nurse is by getting your associate's degree. Next slide. Okay, so we talk about sustainability, like why would people set this up and how is it sustainable? We're using people who actually work in the hospital to teach other people what they do. So in order to do that, we have a relationship set up between the employer and the educator where they're on a dual service contract and their time is paid for by the education provider. We're also making sure that employers who are starting this work have a wraparound support system set up for individuals. That's pretty robust. It looks like financial aid counseling, academic counseling, mentorship on the job, and did I say socioeconomic support? Yes. Each individual who goes through this has an employment agreement, and the agreement is that they agree to work for each year of education as a registered nurse when their licensure is completed. And the employer, it actually works out very nicely. The employer uses a loan repayment model instead of tuition assistance. The concept there is that there's no out-of-pocket expense for the individual who's going through their program, and the employer pays back the loan over those 3 years that the individual is working for them. So it's a dual, it's a retention strategy, but it's also, it works well for the individual who's in the program because they don't have any out-of-pocket expenses. Next slide. This is sort of a diagram of what it looks like. In the red, you can see that we have it identified as a licensed nurse assistant, but you don't have to be a licensed nurse assistant. At some of the hospitals, they'll let anybody do that work. Typically, your first year of education, you would be in a health science prerequisite 14 credit program. That's basically a pre-apprenticeship. Year 2, you would be in the license program, licensed practical nurse program. And then year 3, you would be in the registered nurse associate's degree program. So it's a stackable credential. I was just going to point out on that last slide that your loan is being repaid immediately, but it's over a 3-year, when you finish that year of school, it's 3 years before it's the completed payment. So the years that you really don't want to leave are the years that you have the biggest debt, years 3 and 4 on this timeline. Next slide. So we say, you know, what are the savings to individuals who have started a program like this? Pretty significant, and I'll show you some numbers on the next slide, but this one just describes the value of supporting committed employees. So these are people who already work for you. It's building trust and loyalty. When we asked the group of employers at the Vermont Association of Hospitals annual meeting, what's more important to them, getting new people in the door with skills or keeping the good people that you already have? The answer was keeping the good people that you already have. So I'm just going to say it's pretty important having a retention strategy, but it also improves recruitment. Next slide. Okay, so this is our return on investment. We want to just demonstrate here that we have one of the most expensive state programs for education in the country. This is where we make the top of the list. So if you wanted to get your associate's degree registered nurse at Vermont State University, it's the only program in our state. It will cost you about $30,000 a year. That's a lot. I mean, when you think about it, other schools have community college programs and, programs that cost $30,000 for the entire program or less. Some are like $15,000. But if you're doing it in Vermont and you don't have any financial aid, it's going to cost about $30,000. Most people who are in these entry-level roles do get financial aid. But if we consider paid release time so that they can actually get their education without having to give up their personal life and all their time with their families, we're adding an additional $13,000 for the time that they're paid for and released from work so that they can retain their full-time benefits. If we backfill the clinical educators who are actually going to be teaching them for the part of their training that's in the clinical setting, we're looking at about $5,000 per individual. This is spread over a cohort, assuming. If we include wraparound support costs, another $2,000, the shared administration for the program, about $2,500, we're looking at a total of about $52,500 a year. But when you compare that to what the bill rate is for a traveler, for a registered nurse, the bill rate is about $252,000. So that's pretty significant. It's a no-brainer for return on investment for nursing, but I think we could probably include a whole bunch of other numbers. I'm just going to say this is simplified version of that. There's really no reason not to do it. In fact, you'd have to come up with a pretty good reason not to do it. So we have a number of those going on in our state. Questions?
So we covered a lot here, and maybe one question we could start with is, why does this matter to chamber executives or leadership and industry associations? And I might ask Marianne, like, why did the Vermont Business Roundtable take on this task of developing the employer collaboratives and thinking about apprenticeship programs?
Well, I'll just say we didn't have anybody else doing it. And it was one of those things that we all agreed it was important. We had a visit from the U.S. Chamber where Jason Tisco, the person who Niki referred to, who was sort of the author of this work, he came to the state and he did a presentation, and we included a number of employers from around the state and also state agencies and educators and things like that. And a lot of people think, this is what we need. But we didn't have anybody who was willing to do it. So we raised money from the employer community in order to start the talent pipeline here.
Great. Any questions for Marianne or for myself about this approach and how you all as leaders from your organizations can support employers in thinking about apprenticeships as an option? Or how many of you are working on or discussing apprenticeships with your employer partners? Is there a way, Cece, where we could just see everybody that's on the call instead of just us?
Yes. So if people do have their cameras on, they will be able to be viewed in the gallery mode.
Okay.
So it really is just if people have their cameras on, we will be able to see them. If that be the case.
Great.
So we do encourage you, if you do have questions, please drop those in the chat, or as Nikki said, raise your hand if you have any questions that we can help clarify. It looks like we do have one here, a couple in the chat here.
Yeah. It looks like Linda put one in. Marianne, how large are the employers that are funding your 2 programs?
Well, we're using I'm going to say we have different funding models, but I'll describe them in a little bit. Most of the employers who we're working with are hospitals, but our hospitals are relatively small. So our largest hospital in Vermont is 550 beds, and our smallest one is 30 beds. So and both of those sizes are everything in between that. So we have 9 hospitals who are using the program, and 1 home health agency and 1 residential care facility. So just demonstrating that it can be done at any level, but the need for nurses is pretty substantial.
Yeah, and I'll say, Linda, that Marianne is giving kind of one example of how this has been applied. When I talked in the beginning, we have practitioners all over the US and in some other countries too, thinking about the use case for this and how to support employers kind of tackling these challenges. We have employer collaboratives that have 3 employers in them, right? And we have employer collaboratives when you look at an area like Houston that have 90 employers, right? And you can think about the size of some of the employers in a region like Houston, or if we think about our partners who are in Tallahassee, San Diego, the Phoenix region. Phoenix has a similar use case to where they were looking at their healthcare partners and their hospital systems were looking at challenges in their workforce, and they came up with 6 specialty nursing areas, right? And apprenticeship wasn't the approach they took. They were able to build new clinical facilities and actually standardize a program. But I think maybe if they were addressing that program now versus when they did 5 or 6 years ago, they might have looked at apprenticeship as an option. And I know in San Diego, some of our partners are looking at apprenticeship in nursing. So this can be applied really, really anywhere, right? It's just, do you have the right component parts together? And I would guess that if you had a conversation with many of your employer partners, they're doing a lot of these activities that, when put in the right order, create an apprenticeship program. They just don't know that's what they're doing.
So I was going to mention that one of the ways that the funding has worked for this program, we have this loan repayment model, and it's actually a recycled loan. What happens is each individual who's selected for an apprenticeship has to work with a financial aid counselor to fill out their FAFSA and apply for any grants or scholarships that are available in the systems. We call that free money. It's not free, but it's like, grants and scholarships. You don't have to repay it, right? So anything that's left becomes part of the loan repayment model. And sometimes that's 0 for individuals who are extremely needy, because, they can be eligible for a Pell Grant and a variety of other things. But for the folks who have financed part of their education, they have no out-of-pocket expense, which makes it really nice. The employer, on the other hand, we work with this financial aid provider, and they set up a model where the employer actually pays for that person's loan up front, and the individual takes the loan, and the employer also repays it. So they're, in essence, paying it twice, but because it's reduced risk, it goes back into their own pool of funds to be used for the next cohort. So I can go into like a dissertation on that later if anybody has questions, but it is a really cool concept. By the end of year 4, each employer who's using it has like a self-sustaining fund to help pay for tuition.
It's really fascinating, and I would highly recommend you to reach out to Marianne to learn more about how they're doing that and why that initial investment from employers on the front end can help sustain their goals long term. Dexter, hello. I see you have your hand raised. What
Yes.
question do you have for us?
Hey, Nikki. Thank you. Hey, Marianne. Great job. Kudos on all the excellent work that you all and your team of partners are doing. I know a lot of commitment, of planning and passion goes into that, and you create a lot of significant opportunities there in your community and region across the state. So congratulations there. Wanted to know very early on, as you began to take a dive in the data, to really inform the design of your approach. You have some communities that are looking at, because you could go down the apprenticeship route, registered apprenticeship route, or a non-apprenticeship route. And so as you begin to look at those types of strategies, what were some notable data points that stood out to you all to kind of inform the route that you wanted to go?
I think, when we start collecting data, we do like a sort of a hypothesis first, like where do you think most of these people are, what the biggest need is? Do you think it's from replacement positions, or do you think it's from new jobs? And the irony is we're always wrong, right? Like whatever we think it is, we have just proved it like completely different than what we thought it was going to be. With the possible exception of nursing after COVID, right? Like once we did the research for that, we realized that COVID just made the attrition numbers go crazy in the field of nursing and through all of the fields of healthcare. They've all kind of gone through some structural change, but I'll say I think things are starting to calm down a bit. People are feeling a little bit more stable. Retention is starting to increase, things like that. We do the forecasts every 2 years. So we ask people to forecast out the next 2 years. We give them some pretty good information on how to forecast, and I think, does that answer your question? The data?
Yes, I think that definitely addresses part of the question. And I guess you have some communities think about the pros and cons of an apprenticeship route and some of the additional paperwork and things that come with that versus a non-apprenticeship route, but still able to set up those types of career pathways. And so just kind of thinking about that decision matrix between those two particular strategies.
Well, I was going to say, so apprenticeships and paperwork, that they go together, right? I actually think that if you were to sit through a class on apprenticeship, you could learn a lot about the steps involved in a registered apprenticeship. But what's important to the employer? Probably not that, right? So one of the biggest benefits of having a registered apprenticeship is that you have an industry recognized credential at the end. And the reason that the nursing one is not registered is because the added value of the paperwork and responsibility associated with that, we didn't have any funding to support it. So the individual said, well, we all end with a college certificate or a degree, right? Certificate for the practical nurse licensure and the degree for the associate's degree. And we all end with a licensure exam, which demonstrates competency. So what's the added value of having an additional registered apprenticeship piece to that? And I invited our state labor department and our industry intermediary for healthcare to come and talk about the value of registering their apprenticeship. And truthfully, without the funds to go with it, we couldn't make a case. And the employer said, you know what? It's still an apprenticeship, but it's not registered. So you have to, kind of listen to what the employers are saying, but you're right on track there when you say we're expecting, some people will say, why do we do that?
Yeah, And I would just add to that too, Dexter. So I was chatting in the chat on the side while you guys were going, and we just wrapped up, and Marianne was there, our second pilot workshop around apprenticeship in Michigan. And I made a comment there that the number of people that were just in the room for this workshop, there was about 50 of them, were more than the number of people in the entire state of Vermont that are resourced to think about apprenticeship as their job, right? And so it really does depend on your community and the value of doing the registered apprenticeship piece. In a state like Michigan, it makes a lot of sense to register your apprenticeship program because the funding, the support staff and resources that you'll have available to you, exponential to moving your program forward. In a state like Vermont, and in an industry like nursing that already has a credential associated with it at a national level, it might not make sense to do the registered apprenticeship route. But as Marianne said, if and when they're ever ready to do that, if the tides turn in Vermont, they are structured in a way that we know is a proven process, as it could be if it were a registered apprenticeship program. So I think that's one of the pieces too of what is like that value add. What are the resources available in the community? Who's there to support it? And even if you don't go the registered apprenticeship route, what are the measures of success that we know make that such a valuable process for people to have that we can embed into the way that we develop our non-registered, our little a apprenticeship programs.
And Nikki, I did just want to draw attention. There was a question in the chat about construction, about the construction side, especially since they saw value and made significant investment. Just wanted to be sure we touched on that question.
Yeah, Marianne, do you want to talk about how you all decided to, that one is a registered apprenticeship, right? And they use NCCER's programming. So I think that one would be interesting for people.
Yeah, I love this story because when we started with that group, there was no standard curriculum for teaching someone how to build, build anything really. We had CTEs, 15 of them. Most of them were youth only. We had a couple of nonprofits that did adult programming, but the content of what was delivered in those was, all different. It was whatever that teacher was able to do. So in some places they were building a shed, and other places they were, working on a neighborhood condominium, doing some repair work and different things like that. But we had a group of employers who had heard about this NCCER core curriculum, which is like sort of the basics for any trade. And it basically had to do with like using hand tools, using power tools, basic communication, blueprint reading, things that you would need to be successful. It was like a 72-hour course. And once the employers created those incentives that said, we will interview anybody who, completes the NCCER core curriculum, and we'll pay them a wage above standard, meaning above what they normally hire someone at. That became a real carrot for the groups of educators. And we wrote a grant. We got 32 educators trained to become certified to teach it. And then we had about 150 people who went through training in that very first year. So, these things, they do take time, but once employers start leading and offering those types of incentives, it brings the education community along. Now, what ended up happening was some of those people got hired by employers, but they didn't have enough of the skills that they needed to be effective as a carpenter immediately. So they said, what if we were to take that core curriculum and build onto it with other components from the NCCER other courses? So this is for really commercial carpentry. We call it commercial craft professional as the apprenticeship. But we added some more basic safety. We added Carpentry 1 and Carpentry 2. We added like other features from different pieces that had to do with blueprint reading so that people had really all they needed to go out and be effective on the job. And there's even going to be an additional like level 2 and a level 3 after this, because they really want to give people all they need so that they can go out and do everything on the job. So that's one of the most exciting parts about this Vermont Construction Academy.
Excellent. I know I love the questions, and this is, I think, such a constructive time, is taking the material and then really seeing how it applies in the specific questions. So thank you all so much for your participation. And we would just like to, again, thank Niki and Marianne for putting this on today. I know it's been very insightful and a lot of value gained. And just as a reminder, a recording of the webinar today will be available afterwards if you'd like to view this and the presentation materials. And I would say these two are such a fabulous resource. I know Niki just dropped in the chat her email there. And please feel free to reach out to both of these individuals. They are truly incredible. We appreciate you guys joining us today. And just as a reminder for those that joined a little bit later, Institute is a CAE and a CCE approved provider. So attending today does qualify you for 1 hour of CAE credit and 1 point of CCE credit. And you can go ahead and email us to the IOM inbox at iom@uschamber.com to request that certificate. And thank you again both so much for your time. We have their communication here in the chat, and just wanted to thank you again for joining us today. Hope you guys have a lovely rest of the day, and thank you again.
Thank you.